Hi everyone, I am Asra and today I'll present our work titled Unrest and Trauma Stays With You Navigating Mental Health and Professional Service Seeking in Kashmir on behalf of my other co authors Ishika Joshi, Nadia Nahvi, and Pushpendra Singh. Mental health well being is a global concern with disparities in treatment services being a challenge. Though digital mental health interventions are proposed to bridge the gaps and supplement support and assistance, yet many individuals still struggle with mental health issues, particularly in regions encountering socio-political unrest and face obstacles in seeking professional assistance. Situating our work in Kashmir, India, a region with a long history of socio-political unrest has led to profound socio-economic challenges and impact on well-being, including disrupted education, increased unemployment, and substance abuse. This has also resulted in high rates of mental health issues, with approximately 45% of the population experiencing anxiety, depression, and PTSD, far surpassing global averages. Despite this, only 10% of affected individuals receive treatment due to limited mental health resources, highlighting a critical need for context sensitive interventions. Previous HCI research has explored the intersection of mental health and technology, highlighting the impact of contextual factors like social networks, cultural identity, and resource availability on attitudes towards mental health. While existing literature suggests the potential of technological interventions such as online therapy and digital health tracking, there exists a gap in understanding mental health seeking behaviors in regions of socio-political unrest with unstable internet connectivity. In our work, we adapt the ecological systems theory by building on the prior work that has employed socio-ecological perspectives to emphasize the interplay between factors at various levels within health and illness scenarios. We use the ecological systems theory developed by Yuri Bronfenbrenner as a theoretical framework that examines human development and behavior within multiple interconnected interacting systems. These systems span from personal environments to broad societal contexts, including microsystem, which is the inner layer including the immediate environments in which individuals interact daily, such as family, peers, schools, healthcare services, and workplaces. Mesosystem focuses on the connections and interconnections between different microsystems. Exosystem includes settings that indirectly influence individuals even though they may not directly participate in them. For example, community services, media, or policies that influence access to mental health services. Macrosystem encompasses the broader cultural, social, and economic context. Cultural norms, values, beliefs, and historical events are a part of macrosystem that can shape help-seeking attitudes and practices. Chronosystem represents the dimension of time and how changes and transitions over time can influence individuals and their environments. For example, historical events, political instability impacting professional help seeking behaviors. We use this theory to draw our discussion from our findings and reflect on the interplay of influences at different levels in an individual's mental health support seeking journey, which is crucial to understand in our context. For this work, we engage in an exploratory study where we sought to understand the following research questions. What are the experiences of the people seeking professional mental health services in Kashmir? What barriers and facilitators exist in accessing resources and mental health services? How do the use of technology such as online therapy, helplines, mobile apps, or social media platforms impact the experience of people in Kashmir seeking mental health services? All the authors of this work are of Indian origin, comprising 3 females and 1 male having prior experience working with diverse communities in India. Our team includes a female practicing clinical psychologist and HCI researchers. Their work has focused on conducting research in the field of HCI to explore the utilization of digital technology in education and healthcare settings. Two of the authors of this paper are born and raised in Kashmir and have lived experiences from the unrest and the political events that have shaped the region's history. And for this study, participants were recruited using convenience and purpose use sampling facilitated by a clinical psychologist at a private clinic in Srinagar. We conducted 18 in person semi structured interviews at a clinic in Srinagar from mid Feb to April 2023, involving clinically diagnosed participants seeking professional support for over 6 months. The interview sessions were focused at exploring themes including access to mental health services, cultural beliefs, barriers to care, political unrest, and technology's role. We collected the data in the form of audio notes, field notes, with prior permission from the participants. The audio recordings were translated and transcribed to English as necessary for analysis. We used an iterative, inductive, and open coding approach for the thematic analysis of the data. Through our analysis, we highlight our findings in three significant themes where we offer an understanding of the unique socio-political and socio-cultural challenges in seeking mental health support in Kashmir, then detailing individual strategies to navigate obstacles and their use of technology for mental health support. We found that mental health struggles were deeply rooted in the context, mainly attributed to socio-political and socio-cultural influences. For example, participants mentioned witnessing violence like firings and bullets during routine activities leaves lasting impressions, significantly impacting individuals' well-being. In moving forward and seeking support, we found that acknowledging the need for help is crucial despite facing stigma, privacy concerns, and personal apprehensions. Participants expressed aspirations for a better future while navigating help seeking, with concerns about anonymity and privacy hindering some from seeking support, as is also expressed by participant 9. Exploring patterns, challenges, and expectations regarding technology for mental health support reveals varied perspectives. While technology offers avenues for seeking support, participants highlight struggles with misinformation and false claims online, leading to skepticism and concerns about credibility, as is expressed by a participant. And drawing from the ecological systems theory, we highlight diverse influences on mental health support seeking journeys that are essential for designing sustainable interventions. We address complexities and interconnections between systems, highlighting the impact of socio-political and socio-cultural factors on our context. We offer socio-technical design recommendations and suggest how effective solutions should be designed across all layers of the ecological model. For chronosystem, we suggest developing adaptable systems that integrate technology seamlessly with human support structures, ensuring flexibility and responsiveness to evolving needs over time. For macro layer, we suggest designing technologies that are sensitive to the diverse socio-cultural and socio-political contexts in which they operate, promoting inclusivity and cultural relevance in mental health support services. For ecosystem, we suggest implementing security measures and prioritizing user privacy and design of mental health technologies, fostering trust and confidence among users, and safeguarding sensitive information. For micro layer, we suggest creating technologies that empower individuals within their social networks, facilitating meaningful connections and support systems to enhance mental health well-being in daily lives. There are more details and suggestions in our paper. We invite you to read the paper for that. Thank you for listening.